Okay, are you ready? We're heading back to medical school or nursing school. Going to go through some anatomy and I'll try and make it as painless as I can. So, let's start with simple. This is the frontal bone. This is the parietal bone. Temporal bone, zygoma. Okay. Now, this becomes important. See this spot between the frontal and the zygomaticus? This is the frontozygomatic suture. This becomes very important later, so remember this guy. But to give you a little preview, when you're doing an eyebrow lift, the injection goes below the frontozygomatic suture. Okay, now we got the maxilla and the mandible, and that's about it for bones. And now we're moving on, and you want to have a look at the, no, we don't need those. Oh yeah, then we're looking at the nasalis or the nasal bone and the nasal cartilage. So here's nasal bone, there's nasal cartilage. And I guess what I wanted to point out on here is here's the orbit, right? That's the orbital rim. And also down here is the infraorbital foramen, and this is the supraorbital notch. All of this stuff will become important later. Okay, and then we're getting into next layer is the arteries, which looks kind of scary, but it's not that bad. This is the facial artery down here. And you notice that it comes all the way up and it has a couple of branches that go out towards the lips here and here. And then it keeps coming up here and eventually turns into the angular artery. Okay, so that's a biggie. And then there's this infraorbital artery right there. And the supraorbital artery is here, and the trochlear artery is here, supratrochlear artery, and superficial temporal artery is over this way. Okay, so you got your facial, which turns into angular, the infraorbital, supraorbital, this guy trochlear, and superficial temporal. Now, the good news is you really don't have to remember any of them because arteries mostly bounce out of the way. If you do your Botox in the areas that I'm going to tell you to do it, then you will almost never hit an artery. So it becomes moot to figure out the exact names of everything, but you should probably know where they're located. So this is what I'm trying to do for you here. Okay, now we're going on to the veins. Oh, we'll skip nerves because there's just a mess of them everywhere. And they really don't become that important either, and I'll tell you when they are important. So, veins, almost exactly the same as the arteries. The difference is that the facial artery is a little more posterior. The vein is more posterior than the artery, and you'll see that on the next slide when we have them superposed on each other. And these are the guys that are going to cause bruising for you, especially around the glabella. Up here, this whole area is a real bruiser. And also, it doesn't really show on here, but there's a series of small vessels that are located right at lateral to the orbit. And those will cause a lot of bruising when you go to do your orbicularis oculi muscles. Right, then we're moving on, and oh, that's just a scary shot. But again, not that bad. The point is that look at the facial artery is located very far forward compared to the facial vein. Okay, so there's more stuff to look at here, and this is where we get into the muscles that we're actually concerned about. Okay, so now you've got the corrugators, which are really important little guys right here. Corrugators are the ones that are responsible for those 11 lines between, like in your forehead or a glabella. So they don't look like much here, but those are actually very strong little muscles. And what's really important in this picture is the fact that the corrugators are very deep, and you'll see that they get completely covered over by frontalis muscle. And that becomes important when you're doing your glabella because you have to plan your injection to go deep to the frontalis in order to hit the corrugator. If you don't go deep enough, you'll hit frontalis and you'll actually get the opposite effect of what you were going for. So there's corrugators, and then we've got levator palpebrae in here, and that's the guy that's responsible to elevate the eyelid, which means if you inject it by accident, then you're going to get ptosis, and that's a really bad thing. There's nasalis muscle again, and temporalis, just for interest's sake. Next layer brings in a couple new things. Now we've got frontalis, all right? So frontalis is a very superficial muscle compared to the corrugators, right? So now you can't even see corrugators anymore because they're buried underneath frontalis. And the other thing to notice on frontalis is that there are two muscle bellies with an aponeurosis in between, right? There's the aponeurosis, and here's belly 1, belly 2. Some people don't have much of an aponeurosis, and some people it's very wide. So that becomes important when you're trying to plan your forehead injections. I don't think there's anything particularly new here. Okay, now we've got Procerus in here now, right? And we've added Subicularis oculi and Abicularis oris. So these guys, the Abicularis oculi and the Abicularis oris, are both purse string muscles, and that's why we have the crow's feet and the vertical lip lines. Notice that Procerus is kind of continuous with frontalis. And then the next one we get into Zygomaticus major and minor. Again, they don't look like much, but they're important. There's Zygomaticus major, and there's minor. Nope, here's minor up here. This guy also lifts the side of the mouth. It's the Levator Anguli Oris. So that'll be interesting because that's the LAO, and you'll see the DAO soon, which is something that we're going to inject. And the other one that got introduced here is mentalis, which is also commonly two muscle bellies, sometimes just one. Next slide. This is an important guy here. Levator Li Bi Superioris. Now we're not doing any Botox injections right in this mid-face area, so we really don't have to worry about it. But I want you to know where he is and who he is. Okay, the next slide is going to bring in something that we're interested in, and that is DAO, Depressor Anguli Oris. That muscle pulls the corners of the mouth down into a frown, and that is an injection that we're going to try to do. Now, here's something important. So we got your DAO, and you got your mentalis, and in between is this guy, Depressor Li Bi Superioris. Depressor Li Bi Superioris it pulls down the lower lip and draws it laterally. We do not want to inject that. So we are going to do the DAO, and we're going to do mentalis, but we don't want it diffusing into the DLI. Another muscle that comes in here is the risoris, and this is the guy that pulls the mouth laterally. We're not planning on injecting him either. So that's pretty much it. See, it's not that bad. You got your arteries that are going to bounce out of the way anyway, mostly the facial artery and the angular artery, superficial temporal, supraorbital, infraorbital, right? And then you got your veins, which are following pretty much along the same lines as the arteries, and they're going to cause some bruising right here at the glabella and sometimes here around the crow's feet. And then in terms of muscle, you got your frontalis on top with the corrugators buried underneath, under there. Then you got your Procerus and your Abicularis oculi with the levator palpebrae in the center, which is responsible to pull the eyelid up. And then you got all of these guys that are your smile muscles that mostly we don't want to hit. You got your Abicularis your Abicularis oris, and your DAO, mentalis, and the one in between, the Depressor Li Bi Superioris, that you don't want to hit. You may want to come back to this at a couple points during the video series just to refresh your mind on where everything is and how it's located. I love these pictures. Incidentally, I found this at univadis.com, UNIVADIS. So I hope that wasn't too painful.